Until today, we have only ever heard about what cancer can do, what cancer will do, the effects of cancer. But today here, I'm about to tell you what cancer cannot do. Cancer is so limited. It cannot cripple love. It cannot shatter hope. It cannot corrode faith. It cannot kill friendship. It cannot suppress memories. It cannot invade the soul. It cannot steal eternal life. It cannot conquer the spirit. Assalamu alaikum. Thank you so much for being here with me today. My name is Muhaimina Janmohammed, and you may or may not know, but I'm a recent first-time author of the book, Discovering the Can in Cancer. Before we start this wonderful interview today, I'd like to tell you a little bit about myself and of course my book. Now that you know my name, I am an undergraduate student at Ryerson University, Canada, studying the Bachelor of Science in Mathematics and its application with a minor in economics. I'm a friendly person, a public speaker, and now an author, alhamdulillah. Discovering the Can in Cancer is a real life story of my family that shows the struggle that we faced when hit by this unforeseen enemy. This unforeseen enemy is cancer. This book shows how a family of 5 sailed through storms. This book is about my mother's journey that shows her determination, her positivity when fighting this enemy. This unfiltered, real life story shows the importance of family, without which nothing in life is achievable. This book shows how I, as an individual, as a small 16-year-old girl, grew up and matured. My goal through this book is to send across the message that cancer can be fought and victory in this battle can be achieved. And what's better than having a wonderful oncologist with us here today who will tell us how exactly we can kill this cancer and we can fight this war and we can win this battle. So it is my honor that I have today here with me Dr. Riaz Kasmani. Dr. Riaz is here with us today. Thank you so much, Doctor, for being here. Dr. Riaz has completed his Master of Medicine in Internal Medicine at University of Nairobi and worked as a consultant physician in the Ministry of Health before joining Aga Khan Hospital, Mombasa in 2012. He then proceeded for sub-specialization in medical oncology to Tata Memorial Hospital, Mumbai, India. Tata Hospital is a world-renowned hospital and the largest and most prestigious oncology center in Asia, with a lot of research undergoing. After completing his training, Dr. Riaz worked at the oncology clinic at Kenyatta National Hospital. Dr. Riaz further did an intensive training in palliative care at the Marie Curie Institute in Paris, France. Dr. Riaz has been awarded a founding fellowship in the Faculty of Internal Medicine by the East Central and Southern Africa College of Physicians. We have with us here Dr. Riaz. Thank you once again for being with us here, Doctor.
Thank you for the kind introduction. It's my pleasure.
So, Doctor, whenever in school we've studied a lot about cancer, we've heard about cancer everywhere. The first thing we do is we go on Google and we type, what is breast cancer? What is cancer? But today we want it from the horse's mouth himself. Tell us, Doctor, what is breast cancer?
So, breast cancer or any kind of cancer, generally, let me start by telling you what the biology of cancer is like or what our normal biology is like. Generally in our body we have cells which are growing all the time and cells which are dying all the time. We get injured and after some time you see the healing has taken place. We get surgeries and after some time the healing has taken place. So the cells are growing and some are dying at all the times. Now when that scenario, there's something wrong with that, and that equilibrium is disturbed, so that we have more cell growth than the cells which are dying, those cells accumulate into a tumor, and that is what creates a cancer. So the same way in breast is, if there are cells which are accumulating, abnormal cells which are accumulating, and that creates a cancer. So those cells might be from the breast tissue, from the ductal tissue, from the lobular tissue of the breast, or from the normal mesenchymal or support tissue, and that's how the cancer accumulates.
What are the signs and symptoms of this cancer, doctor? Breast cancer especially.
There are very many different signs and symptoms which we may get, but for this purpose, let's just focus on breast cancer alone. So in breast cancer, the biggest sign is a breast lump or a growth. So any abnormal growth in the breast or a lump which is being felt either in the breast or in the axilla, that's the armpit, should be investigated as soon as possible. The other signs could be is that there could be discharge from the nipple, either any serous kind of a discharge, that could be a colorless discharge, bloody discharge, should always be looked into. Sometimes we also get skin changes, and the skin over the breast might look like an orange skin, what is called peau d'orange. So if you see any kind of skin changes, dimpling, or some kind of puckering in the skin, should always be looked into.
And doctor, what are some of the causes of breast cancer?
By and large, most of the cancers occur without any definite cause. Most of the 90% of the cancer might occur without a definite cause. However, there are a few causes that we really need to, or risk factors that we really need to look into. One could be genetic. So breast cancer can run into families and by genes. So there are like two definite genes which are known, like BRCA1 and BRCA2 genes. We have all heard of a very famous actress called Angelina Jolie. So if you know her story, she underwent breast surgery. She removed her breasts and she had reconstruction done. She also removed her ovaries. Why did she do all that? Is because her mother had cancer, and when she tested for the genes, she was found that she was BRCA1 and 2 gene positive, which means that she was at a risk of developing future breast cancer. So she decided to do away with the breast and had reconstruction done. However, that's a very drastic way of dealing with it. Not everyone would deal with such with the risks in such kind of a manner, but that's just to show as an example that genetics play an important role. The other risk factors are patients who have had early menarche and late menopause are at a risk of breast cancer. Patients who have not been breastfeeding, patients who have had many children. Basically, that means that they are probably exposed to long-term estrogen and progesterone hormones, so their risk factor increases. Then patients who, or people who are obese, they are also at a risk factor. Probably that could be in the sense that some of the smaller lumps might not be felt very easily, but generally inactivity, obesity, high fat diet, their risk of any cancer as such. Then people who have had prior breast problems or any issues in the breast run into a risk of developing future breast cancer. So probably now we could ask, what is protecting against breast cancer?
Right.
So for protection against breast cancer, breastfeeding is a non-protective factor against breast CA. Then healthy bodies, preventing from obesity, exercises are also protective, And if you have had any genetic predisposition or you have had any prior issues with the breast, then you should be going for regular screening and regular testing.
So the regular screening, do you only advise it to people who have history, or it's good for us women to have the screening at least once a year or a few months to just keep ourselves healthy?
So people who have had genetic predisposition, their screening starts early.
Okay.
So by 25 years of age, they should already start on the screening.
Okay.
And the ideal screening, which is actually recommended by the NCCN guidelines, that are the National Cancer Institute guidelines,
Right.
is to do MRI for the breast. However, that is not always available, so we resort to ultrasounds and mammograms. But for general people who do not have any real predisposition factor, so then their screening starts after the age of 40 to 45. That means that after the age of 40, they are supposed to go at least a biannually mammogram or an ultrasound with a regular breast checkup by a clinician, at least an annual breast checkup by a physician. However, all women, whether they are at a risk factor or no risk factor, are recommended to be doing self breast examination from as early as possible.
Yes. Doctor, once you're detected with cancer, now you know you have cancer. What are some of the treatments you prescribe? Do they differ with levels of cancer? And what treatments differ with different people? So what are the kind of treatments?
Yeah, there's no standard treatment for anybody. It all depends on the kind of breast cancer you have, the stage of the breast cancer you have, the type of the breast cancer you have, because you could have a ductal breast cancer, you could have a lobular breast cancer, you could have a sarcomatous breast cancer. So all of them, the treatment is different. Then again, it depends on what kind of a histology do you have. That histology means that what have we examined under the microscope. So once you examine under the microscope, you know the grade of your cancer. So it could be grade 1, grade 2, grade 3, all of them have got different kind of treatment. Then again, we look for hormonal status of the breast cancer so that we could know whether they are hormone positive, and then there are other markers like HER2 positive or negative. So this, once we get these markers, we know what kind of a treatment to give you, how aggressive your cancer is, whether you will benefit from anti-hormonal treatment or not, or whether you will benefit from targeted treatment from HER2 or not. So it's entirely different. Again, even if it is a stage 4 cancer, that means that it is a cancer which is spread. All those players come into play, and we look at the dynamics of the cancer to see how aggressive it is, or how what are the markers, so that we can determine what kind of treatment can help you.
I would like to take this note that Dr. Riaz Kasmani was and still is the doctor of my mother. So doctor, if we go specifically into mom, why did you prescribe her the treatment that you did, and what exactly was the treatment that you prescribed her?
So we found her treatment at stage 2, which was very good. It was an early stage treatment, and she had already done her surgery, so there was no metastasis. That means it was not spread, which was very, very good. However, if we looked at the surgery, the number of nodes which were removed from the armpit were less. So we decided to give her full treatment by chemotherapy, so that we kill any kind of cells which might have been lurking there and might not have been removed. Microscopic cells which cannot be seen by examination, cannot be seen by imaging, but we know that there's a possibility that those cells might be lurking somewhere there. So we needed to kill those, and then due to the size of the tumor and the tumor dynamics, she underwent radiotherapy, and after that her tumor was ER/PR positive. That means it was hormone positive, so she benefits from anti-hormonal treatment. So that is what she's undergoing at the moment.
Wonderful, alhamdulillah. Doctor, how do you lower your chance of getting breast cancer?
How do you?
Lower your chances of getting breast cancer? Is there a way, or is this luck, or?
Well, as I said earlier on, that almost 90% of the breast cancer just occurs without any kind of risk factors or something, and you would just find that you're having breast cancer. However, if you have any of those risk factors which I outlined earlier on, then you need to start your screening early enough, so that sometimes we might just catch that breast cancer even before it has become a cancer. So we catch that cancer while it is just in transition. We call that carcinoma in situ, meaning that it's still not full-fledged cancer, but those cells are becoming cancerous. So we can catch it at that juncture. Regular self-breast examination, so that should you have any kind of abnormality, the earlier it is dealt with, then you might have a chance of catching that breast cancer before it has become cancer, like carcinoma in situ, or in stage 1 cancer. Sometimes when we catch the cancers in stage 1 cancer, you might not really need all that kind of treatment. So we might not even need chemotherapy for a good dynamic cancer in stage 1. So we could just do a surgery and that's it. Or if you want to do a breast conserving surgery, then you just remove the tumor, leave the breast alone, reconstruct it, and just do radiotherapy and plus or minus hormonal treatment, so it becomes easy. But the crux of it is examine your breasts. If there is something abnormal, please go to your clinician as soon as possible.
Doctor, when my mom was diagnosed with breast cancer in 2016, I was only a 16-year-old girl, and when she came home and told us that she was diagnosed with cancer, the first thing that came in my mind was, Mom is going to die, because I thought cancer equals to death. And a lot of people watching this video might be also thinking that cancer always means, oh, this person's going to die. What are your thoughts and views about cancer equals to death?
Totally wrong. Cancer doesn't mean death, especially if we catch cancer early enough and at an early stage. We have a huge chance of curing that cancer, depending on the dynamics of the cancer. We have got many survivors of cancer who have fortunately caught that cancer early enough and have been treated in a correct manner, in a proper setup, and they have been survivors. However, what we also need to remember is that sometimes cancer which has also been caught early, and we have given the most ideal kind of treatment for cancer, there is a chance, 20% chance, that it might recur. Again, to say that there are patients whose cancers have recurred and we have treated them again and they are survivors again. And we have patients who have lived up to the ripe age of 80s and 90s without any cancer coming back. Let's come to stage 4 cancer, or stage 3 cancers, which means it's advanced, or stage 4 cancer, which means it has already spread. Again, it doesn't really mean that it's death. It depends on the dynamics of the cancer, and at the moment we have many new kind of treatments which help us, and newer drugs which ensure that these patients have a long-term survival.
Inshallah, no person who has already survived will get cancer again. Doctor, about Mom, what do you think was her main reason for survival and her victory?
She had a very positive outlook from the word go, and she had a very good social support system. So she was a fighter, and she had made up her mind that she's going to fight, and I think that was really feather in her hat.
That's true. Mom is a fighter. In fact, I don't call her a survivor. At home, we call her the conqueror, because we don't believe she only survived. We believe she conquered cancer.
Definitely true. She did conquer her disease, and she still has a very positive outlook to the whole scenario and what she went through.
Doctor, the most important question of today. So I'll give you a background before I ask this question. If you met my father, Riaz Kasmani, then he's not a man who would be satisfied with one answer to this question. If he asks you a question, he'll want you to answer it 10 times before he is satisfied. So the most important question of today, doctor, how much did my dada disturb you during my mother's treatment?
Well, I would not really call it disturbance because I generally like my patients to understand their disease fully and to be satisfied with what they are receiving. So once you have a patient who is very, very well informed and a family who is well informed on what is going on, then the whole outcome of the treatment is good. And this is generally what happened. There were no gray areas, as I would call. I liked that when he would come, when your mom would come, or when anybody else would come with them, they would ask the questions so that we would cover all kinds of gray areas and even discuss into the future on what we need to do. So that helped us in our treatment. And the acceptance of the treatment, the acceptance of the side effects, and the tolerance of all that treatment was at a much higher level because the whole family was very, very well informed.
That was all because of you, doctor. You were so nice to us. You gave us that feeling that everything's gonna be okay, and for that, I don't think mom, dad, or myself could be grateful enough for.
Thank you.
With this, we have come to the end of the questions for today. Thank you so much, Dr. Riaz, for being with me here today. I'm sure our viewers will also agree with me that we have learned a lot. We've taken guidelines with us back, and we will make sure that together we try to avoid this illness as much as possible. Dr. Riaz, as I said, was the doctor of my mother and still is the doctor of my mother. He is the reason why my mom's treatments went so smoothly. She didn't even realize when her chemo finished, her radio finished. He would come in to her chemotherapy day and he would just be like, Sajida, how are you? And mom would just know, oh, that is doctor coming, and she would never be afraid of him. Lastly, when my mother was diagnosed with breast cancer in 2016, I'd only seen what cancer centers or chemotherapy centers look like in movies and series like all of you have. I was very shocked when I saw what an actual one looks like, and to get the feel and everything was very different for me. So today I'd like to show you a real cancer center, not a set in a movie, not a set in a series. I would like to show you and take you on a tour to the Mombasa Cancer Center, located in the hub of Mombasa, in the town of Mombasa, that helps lots and lots of people, and it is a chemotherapy unit. It has a chemotherapy unit, and it will be a good experience for you to view it. So let's go with me, let's take a tour. When you ask him what he yearns for, he'll tell you that he yearns to be a source of inspiration to the humankind through his speeches, his businesses, his investments. Dr. Odi, in his writing career, has published 30 wonderful books that has inspired people directly and indirectly. Allow me to welcome Suleiman Doro, my publisher and editor of the book, who is famously known as Dr. Odi. Welcome, Dr. Odi. Dr. Odi is a 25-year-old Kenyan with the dream of making this world a better place, starting with our very own continent, Africa. He calls himself the capital of Africa, and that is why he's the founder and CEO of the Africa Pital Group. This group consists of various companies that include media consultancy, business consultancy, and publishing consultancy. So thank you for being here with me.
Thank you so much, Muhaimina. It's been a pleasure, and I feel honored to work with you throughout the process of writing this book. All I can say is that Discovering the Cure in Cancer is a great book, and to me, I think it's a hope and inspiration to all the cancer patients. And to be honest, in my process of book publishing, I think this is one book that has really caught my attention and touched me. I cannot count the number of times I cried, especially at the end of the book during the publishing process. So congratulations to this book, and to all the people who are watching, this book is for you. Through this book, you'll understand how cancer works, how you can treat people with cancer, and it's going to be a good book for you. Thank you so much.
Thank you for your kind words. With this book, I'd like to take the opportunity to reach out to every individual watching this video today that breast cancer, and for that matter, any cancer, can be fought. All you have to do is believe. Mom believed she could, and so she did. Ladies, let us take care of our health. Let us visit our doctors for regular screenings so that we can protect ourselves, so this enemy does not hit us unforeseen. My advice to anybody currently facing this battle, and I'm sure advice from all of us here today, will be that stick to your positivity. Be determined and do not lose your hope. Because if you lose your hope, you've lost this battle. Lastly, now that we're here together, I'd like to announce that our formal launch is scheduled for next month, inshallah. So quickly order your books. So to avoid any disappointments, my contact is placed on the screen. You can contact me via WhatsApp, or you could direct message me on Instagram and Facebook with the name Muhaimina Jan. Lastly, I'd like to leave you with this. Cancer may take your physical abilities, but it cannot touch your heart, your mind, and your soul. Thank you for watching.